Research has shown that approximately 45 million people suffer from bruxism, but dental laboratories fabricate only 3.6 million night guards per year. Dentsply Caulk is proud to introduce iNterra In-Office Night Guard, a simple, effective solution for managing tooth grinding. Now, let's review the iNterra In-Office technique. Block out any severe undercuts with the silicone Regisil Rigid Bite registration material. Repair compromised restorations or segregate patients who are not appropriate for iNterra. Once you've taken the arch form out of the silicone mold, remove, but do not discard, the rectangle-shaped release film. Be sure to keep the arch-shaped piece of flexible film attached to the top side of the iNterra material facing the opposing arch. If it is necessary to size the arch, use slight finger pressure to pull or stretch the material, or use scissors to trim the arch to the desired shape and length. If additional thickness is needed, two arch forms may be used together to form one appliance by pressing the two sides together that do not contain the flexible film. Pre-rinse the teeth with water or mouthwash. Place the exposed resin side of the arch against the teeth. Using finger pressure, adopt the facial and lingual extensions onto the midfacial tooth surfaces, covering most of the lingual surfaces and tooth embrasures. Have the patient bite lightly and observe points where the teeth contact the flexible film on the surface of the material. Ask the patient to lightly bite in various excursive jaw positions. Ask the patient to then bite lightly in centric occlusion, and hold that position while the halogen handheld curing light tip is directed against the facial surfaces. Cure facial surface for 1 minute. Note, add 30 seconds if using an LED curing light. The following tack curing guide can be used to determine the time required for your preferred type of handheld light. Note, if curing double thickness area, double the cure time. Confirm adequate lingual adaptation and step cure the lingual surfaces of the arch for 1 minute using the same technique. Finally, step cure the occlusal surface for 1 minute. If it is necessary to add material after the iNterra device has been tack cured, remove the flexible film and ensure the surface is clean. Adapt additional iNterra material and complete the curing process. Remove the partially cured night guard with a snap release. Seat or reseat the partially cured night guard at least 3 times to ensure proper removal and fit. With the appliance seated, re-cure for 5 to 10 seconds to remove any soft areas. Remove the partially cured iNterra arch from the mouth. Do not separate the flexible film from iNterra at this time. Fill the internal aspect, including all tooth spaces, with Regisil Rigid Bite registration material. Invert the iNterra appliance filled with silicone onto the square celluloid sheet from the original packaging, and wait 2 minutes until the silicone has completely set. Place the night guard into an iNterra VLC extraoral curing unit and cure the appliance for 10 minutes. If using Triad VLC curing unit, cure for 20 minutes. After the night guard has completely cured and cooled, remove the injected silicone and peel away the flexible film. Disinfect the iNterra night guard. Remove any gross flash, rinse, and air dry. Verify the fit of the night guard intraorally. Adjust borders as necessary and modify the occlusion as needed prior to finishing and polishing. Use standard acrylic carbide burrs for adjustments and pumice to finish, followed by polishing compound for high shine on dental lathe. The following guide can be used when reordering iNterra in-office night guard materials. iNterra is the one-visit, custom-fit, chair-side night guard for dreamy results. Dentsply Caulk is committed to making dentistry work the way that's best for you, your practice, and your patients. iNterra In-Office Night Guard is an effective chairside solution to bruxism management that can be obtained in a single visit. Contact Dentsply Caulk for additional information.